today in our session on promoting client engagement in TelePrEP, we'll be getting into kind of how do we continue to engage clients in HIV prevention now that we've moved into a virtual world with telemedicine. And specifically, we'll be talking about the use of the platform Mister to engage clients in TelePrEP specifically. So to give you a little overview, to start the session off, we're going to hear from Tristan, the founder of Mister, and he'll provide an overview of the services that Mister provides. We'll then move into hearing from Tristan, Megan, and Dan. Megan and Dan work closely with Mister and use the services day to day with their clients. And so we will have an opportunity to kind of chat amongst everyone and see what kind of knowledge share we can bring to the table through that panel discussion. We'll specifically touch on working with Mister, how to manage client concerns and general lessons learned. And then we'll have an opportunity at the end for a question and answer session. And this is where you're welcome to unmute yourself and join the audio, join the conversation. We'd love to hear from you and see what conversation we can get going today. So you're welcome to submit your questions as we go in the chat box to myself or any of our hosts, and we will flag those later on in our Q&A session. So great. To begin, I'll just give an overview of the panelists that we have today. I've mentioned their name, but haven't given any information about them. So to start, we'll be hearing from Tristan Shoecraft. Tristan is the founder of Mister. He is a technology entrepreneur and a one-time aspiring politician. His first company, ID90, helped the airline industry transition to 100% e-ticketing. And today, as the founder of Mister, he's trying to help end the HIV epidemic by leveraging telemedicine services. Next, we'll hear from Megan Brunson. Megan is the Chief Operating Officer of Texas Health Action. And her career in telehealth spans over 16 years, in which she has focused on clinical operations and with risk reduction programs across surgical, inpatient hospital, outpatient clinic, and home and public health sectors. And then finally, on our panel with Megan and Tristan today, we'll be hearing from Dan Soto. Dan is the telehealth coordinator at Reach LA, which is a nonprofit organization that provides arts and health services to LGBTQAI+ young people of color in the downtown LA area. Dan is a community advocate from Los Angeles, and he has been involved in advocacy and activism within the HIV community for the past 10 years. So we're really excited to have everyone on here today. I think these speakers will all have really valuable things to share, and I'm excited to talk with them today. So just quickly before we get started, I want to just reiterate some of the Health HIV telehealth services that Marissa discussed briefly in the general session. So Health HIV as an organization does provide a number of telehealth capacity building services, and in the form of webinars, individualized TA, as well as a number of online resources that are available. So if you are interested in seeing more of what programming we have to offer, feel free to visit the link on the screen, healthhiv.org/telehealthhiv, and be on the lookout for future programming. But great, that's all I have for now. So thank you again, everyone, for being here. I appreciate the patience with the wait time getting into the breakout room. And I'll go ahead and pass it off to Tristan now to start his presentation.
Yes, good afternoon, everybody. Thank you for the opportunity to present. So for those of you that are unfamiliar with Mister, we are a telemedicine platform completely focused on increasing access and adherence to PrEP. So, we're much more than the technology function of connecting doctor to patient. The platform is a standalone platform that we've implemented with several community-based partners across the country. And from beginning to end, the system is essentially fully automated and, again, focused on increasing access. Next slide. So yeah, this stat from 2019 is disturbing on two levels. One is from 2019, and we're now in 2021, right? But 217,000 prescriptions were written for PrEP, and assuming that everybody got 4 prescriptions a year, that's a little over 50,000 out of the 1.2 million people that have been identified by the CDC as a benefit for PrEP. So, and I highlight this slide because this is really what got Mr. started in the first place. Mr. started 3 years ago. And, you know, number one is the cost of the doctor visit and labs required for PrEP. And through our community-based partners, we've eliminated that barrier. And then, of course, there's the time and hassle to see the doctor, the requirement for repeated visits. Maybe the doctors are unaware or lack knowledge. And then, of course, some patients just don't feel comfortable talking to the doctor about PrEP. So telemedicine eliminates all of those barriers. And then, of course, there's the judgment and shaming. Maybe some people don't feel comfortable going into a clinic, or maybe they can't take time off work, maybe they can't afford to take time off work. So again, just introducing the ability for patients to interact with the doctors online eliminates all of those barriers. The other big barrier is patient assistance programs. You know, the enrollment is complicated, can be kind of confusing and daunting. We do all of that on behalf of the user.
Perfect.
So, and then when it comes to insurance, of course, you know, we have people, actually 5% of the people that sign up every month already have a prescription and they're just looking for assistance fulfilling it. So, you know, somebody goes to Costco, they go to Walgreens, and they go to pick up their PrEP medication. There's a $500 copay. Essentially, they just abandon their prescription. So with us, we do the patient assistance program, we do the prior authorizations, appeals, everything on behalf of the user. So next slide, please. And that's kind of illustrated here on this slide. So in the upper left-hand corner, people come to Mr. and they answer a dynamic health questionnaire. And assuming that they're a good candidate for PrEP, then they can they do their required labs. And so the required labs we offer in person and at home. 2% of our signups choose the in-person, and the in-person is like a Quest or LabCorp. And then the majority, as I said, choose our at-home testing, which I prefer because, you know, it's a finger prick versus a needle draw. You can do it in the privacy of your home. Again, making it easier for those to sign up for PrEP. And then once their labs are back, they can consult with a doctor. Once a year, we require a video consult with the doctor. And then at any time throughout that year, they can actually contact the doctor via phone, secure online chat. Everything's controlled through the platform. Then once assuming the patient's good, then we send a prescription to the contract pharmacy. Again, I'm kind of outlining the process that we follow, that we've implemented with our community-based partnerships that are leveraging the 340B status. So the prescription goes to the contract pharmacy of the covered entity, and then the medication is mailed for free each month. And as I highlighted in the past slide, there's no paperwork for the end user. We do everything on their behalf. If they need to provide support documentation like paycheck stubs or utility bill, they can upload that to the platform. But if they don't have it, the system automatically generates an affidavit that they can sign online. And there's nothing for them to download. They can use their mobile phone to sign it. Both that and the completed like Gilead Advancing Access form, for example, is uploaded to the patient profile, provided to the contract pharmacy. So it eliminates the time from prescription to delivery. And then with regards to follow-up, when they get their last fill, they also get a notice to renew online, and they get a new testing kit to do their follow-up labs. Next slide, please. And so a little bit more about our lab testing, again, in person or at home. If they go, unlike a doctor's office where you go and get your labs done, you might have to wait to see the doctor. We're sending them into a LabCorp or a Quest. They're in and out in 15 minutes. In any case, whether they choose to do the at-home or in person, we're testing for HIV, Hep B, creatinine, and gonorrhea and chlamydia 3 site. But we also do have the option to add on syphilis testing and Hep C. For those organizations that are looking to roll out a Hep C program, this is a really easy way to do it. We do not accept insurance for the labs, so there's no copays for the individual, and there's no large out-of-pocket deductibles. The reason we don't accept insurance is for two reasons. One, in the early days we did, and we found a lot of people, while 70% of our patient population is insured, a lot of them are underinsured. And so they'll have a huge deductible and they'll get a $400 copay. Obviously, that's not affordable for anyone, and people don't want to pay $400 regardless if it's affordable. And then the other thing is that there's really no great way to validate coverage. So the last thing we want to do is send somebody into a LabCorp when their insurance requires Quest. So there's no exchange of money in either situation, in person or at home. Next slide. So every month we're growing about 20-35% month over month. And that is really, not only is, I talked about in the first slide about telemedicine. Yes, it eliminates a lot of the barriers, but then it's much more than that, right? So, the convenience at home testing, recognizing that a lot of our users skew younger. So, they can communicate with us via phone, email, SMS, they can do secure online chat. A lot of people will send us messages on Instagram and Facebook. And then we've also implemented artificial intelligence so that some of the most frequently asked questions that are asked, maybe somebody's trying to complete their at-home testing kit at midnight, they can get a quick answer online without having to wait till the next morning. So we want to eliminate any reason for somebody to stop, completing their at-home testing kit or delaying the return of that testing kit a day. And of course, making it easy to use. There's a lot of different technology out there that enables telemedicine, but you got to recognize who your users are. So we are not an app. There's nothing to download. We're mobile enabled. And the reason for that is, if you want to download an app, you have to want to download an app. You have to have memory on your phone. You have to have a smartphone. And more importantly, if you have an Apple phone, you need your Apple ID. So, the last thing we want to do is create a challenge for somebody who wants to sign up, but then doesn't know their Apple ID. So there's nothing to download. As I talked about earlier, sign your support documentation online, your mobile phone or your desktop. And then of course, we've introduced our site in Spanish, and it's not just in Spanish, but it has Spanish customer support and providers that speak Spanish as well. Next slide. We're really good at marketing. We do extensive amount of marketing. So when we partner with a community-based organization, it's not like there's a ramp-up period. Essentially from day one, we're bringing clients in. So we do, pre-COVID, we did a lot of events. And we do paid advertising on the dating apps, on social media. We utilize influencers. And so again, as soon as we turn on a partnership with a community-based organization, there's immediate influx of patients. Next slide. So as I kind of described here, we're really an all-in-one solution. We're the PrEP navigator. We're doing the outreach. We're the PrEP navigator. We're the provider. We're the labs. We're the pharmacy, all rolled into one. Next one. So who are our patients? Across the board, a majority of them are Caucasian, but I'm happy to report in California, we actually serve more Hispanics than Caucasians, and always looking to expand the Hispanic and African-American percentages all the time. You can see we skew younger, but we have people that are 55 plus utilizing our platform. And, as it's obvious, Mr. is targeted to men. So 98% of our users are male, but anyone can use our platform. And 2% of those are women. 18% of the people that utilize our platform do not identify as gay. And with that said, we are also introducing a specific clinical procedure for the transgender community. And that's not developed just by us, but we're actually engaging people from the transgender community to develop that with us. So it's something for the transgender community, developed by the transgender community. So next slide. So as we saw more and more females signing up, we launched a female-focused brand, and that's Sister. But again, anyone, both platforms are set up that if a male entered Sister or vice versa, they can complete the process. Next slide. And as I talked to earlier, we have a lot of partners across the country. These are just some of them. But through our partnerships, we've essentially been able to eliminate the cost of the lab and the doctor consult for the individual user. And leveraging the 340B program of each of our covered entities, we've generated a new revenue source. Next slide. So currently, other direction. So countries turning blue in more than one way. Today we have coverage in 35 states and the District of Columbia. Again, patient pays nothing, and today our covered entity partners generate around $1,000 on average per patient. So that is Mr. in a nutshell, and I think we'll go to questions.
Awesome. Thank you so much, Tristan. And my apologies, everyone, for the continued technical issues. I am very sorry about that. But great. So thank you for that introduction to Mr. I think that provides a really nice foundation to kind of jump into our panel. So I do have some questions here, and I know we discussed some questions, Tristan, but you're welcome to jump in with any questions as well. But I figure first, it might be best to just see if Dan and Megan, if you could just share a little bit more about yourselves and your background with TelePrEP and your individual experience working with Mr. Just to give us all a sense of where you're coming from.
Sure. Well, I guess I just have to say, I messaged Tristan earlier, but I said, if anyone thought the technology piece behind telemedicine was easy, then I think they've probably been convinced otherwise, because it's really not. The technology is really the hard part. And I think that's, one of the reasons that it has been nice having a partnership where the technology is one of the things we don't have to worry about. So Texas Health Action runs Kind Clinic, is our probably the program that is most involved with our PrEP use, and where we partnered sort of with, runs parallel, I would say, to Mr. because that's our brick and mortar clinics where we provide PrEP, PEP, STI testing and treatment, positive care, and gender affirming care. We have we have 3 clinics in Austin, and then San Antonio as well. So that is, that's what we do. We partner with Mr. in June. Is that right, Tristan? I want to say June, late May, June of last year.
Yep.
Awesome. Thank you. And Dan, could you provide a little bit of your background and your connection to Mr.?
Yeah, so I've been working in the field since I was about 20, 21, volunteering and stuff. And then when PrEP got rolled out, I was working at a medical facility providing substance abuse and HIV treatment and care to young gay men of color. And when PrEP got rolled out, I initiated a lot of the programming and pretty much built the infrastructure of our first PrEP clinic in East Hollywood. And so that's when I first started doing collaborations with Reach LA, and I would come and do workshops for their participants who would come here, and then they would refer their clients to my clinic to get PrEP access, because it wasn't something that they were doing. And then we started working with Tristan here in, I believe, November of 2019.
Yeah.
And it was new to us because we didn't have an established PrEP program. We do testing here, and we do referrals to outside services. And so I joined Reach LA in July to pretty much run their telemedicine program, because up until that point, it was all hands on deck, and we didn't really prepare for how fast the growth was going to be. And so I think the growth was immense, and we didn't have the capacity to stretch everyone thin. So I came on board to strictly manage that. And as we continue to grow this program, now it's come to the point where we have to continue to build capacity, and we're now looking to hire another person to just be specifically dedicated to this. And our goal is to now have just have it be its own growing department, because we realize even with pre-COVID and now during COVID, it's just something that's accessible. It's something that that clients want and are seeking for. So yeah, we're really happy for this partnership, and it's been really great to be able to provide this service to our clients that otherwise weren't able to get it here. So it's definitely opened a door for us here at Reach LA.
Awesome. Yeah, that's really helpful to hear. Kind of along those lines of opening a door, can you speak about the process of facilitating an initial engagement and care with clients using telehealth and specifically Mr. and kind of how do you get that conversation going? And do you have any kind of lessons learned from that process?
I think for us, it's just part of the entire procedure of every client that comes into our facility, whether they're coming here for because we also provide different types of arts programming, so like dance classes. We have a dance studio here, and so every part of our organization, we're constantly letting our clients and our participants know about Mr. Specifically, when they come in to get tested for HIV, during every consultation, we let them know that we have a telemedicine program in-house. And so once they're done with their test and we test them negative, we have laptops here in case they don't have a phone or in case they don't have any internet access or any technology back at their place. We're able to provide them with laptops here on site. And if they have any questions about the enrollment process, if they have any questions about certain paperwork or application, we're all here to facilitate that conversation and to help them navigate through the website, which ultimately it's pretty self-explanatory. It's very rare. It's very rare when we have to actually sit down with clients and walk them through it. So we just have tried to make it so that every client is aware that that's a service that we provide. And if there's any barrier regarding accessibility with technology, we're trying to eliminate that as well with providing that option here. Since they're already here, might as well just enroll them in the process.
Yeah, I would add to that. I just say, yeah, with Mr. We kind of we work with our partners to promote Mr. as much as possible within their network and within the local community. But ultimately, I guess the outreach is our marketing. And then, as Dan said, it's a pretty self-explanatory sign-up process. And so, for example, if somebody's signing up and it says, do you have insurance? No. Then it prompts you to ask, the system prompts 2 or 3 more questions. And then we take those questions and we use that to pre-populate the advancing access forms. And then we, after sign up, they can email saying, we need the following from you, or you can sign this letter online. So it's kind of like an automated PrEP navigation once they start.
Great. And I would say along those lines, so once we've gotten them initiated in care, how does Mr. work to manage retention in TelePrEP services online once they've gotten those patients on board?
Well, I mean, that's our big, I guess, kind of claim to fame. We have an 89 to 91% adherence rate. I think number one, making it accessible online, it's easier, obviously, to for those individuals to do the follow-up appointments. With their last fill, we send out a testing, so they have a whole month to return those lab results, so there's no interruption in service. Some people like email, some people like SMS, so we don't rely on email. We send SMS. And then, at the end of the day, we have various automated and manual processes in place. And if somebody kind of goes off the grid or we don't hear from a patient, then we can work with our local partner to kind of bring them back into the fold.
Great. That's great. I'm going to go ahead and pull some questions in from the chat while we've gotten some in, and then I have some more I can ask afterwards. But some folks are wondering about what options are available for working with incarcerated populations. Does Mr. have any experience using their TelePrEP services in these kind of populations? I'm just curious, and it looks like a couple other people are as well.
We don't have any experience. I mean, ultimately, if you have access to the internet, you can do it. I don't know how the prison system would like us sending lancets, even though it's not a very dangerous
Yeah.
apparatus, but who knows? They get creative
Mhm.
in prison, I'm sure. But AFH, our partner in Houston, I know they do a lot with the prison population, but I don't know if they're utilizing Mister for that population.
Yeah, I think there are probably other methods of PrEP in prisons. I don't know if Mister is probably the preferred access point for the reason that Tristan just pointed out. But I think there are other means, fortunately. But um,
Right. Yeah, thank you for that. And then we got a question kind of along the lines of the scope of Mr. as well. Is there any kind of geographical limitation to who Mr. can serve? And is there international reach to patients?
So we're live in 35 states, District of Columbia. Next week, we're rolling out Puerto Rico, but right now it's all US territories. And our reach really, we're licensed to operate across the country. The reason why we're free in 35 states and not the balance is because we don't have a community-based partner there. So like if we look at Texas, for example, Texas Health Action, they have statewide 340B coverage, so they can really see any patient. And then our other partner in Texas, AIDS Foundation Houston, they're limited to certain counties. So we limit it based on zip code. So we can configure the platform to limit the offerings based on the 340B coverage of that covered entity.
and I think that's one thing I guess I kind of want to highlight that maybe I didn't before is that as a brick and mortar primarily organization, we had a telemedicine offering that, thank you COVID, we had to expand a lot over the last year. But we did not have statewide reach. And I think partnering with Mister really gave us that ability to reach the full state of Texas, which is large. And we really didn't have that ability before. So now we can actually serve folks in really, really, really rural Texas. And it's really interesting looking at some of the individuals that do sign up because they're from areas that really have no access. And we're not going to build a kind clinic in some of these places, or even a couple hours from some of these places. But to have PrEP access at no cost in some of these communities is really life-changing. And so being able to provide that, I think, as an organization was something we looked at and said, like, how do we say no to that? Because we can't. So
Right.
Yeah, and just to piggyback off of Megan, like with us here at Reach as well, like we've predominantly served downtown LA and like South Central area and like mid Los Angeles, but ultimately our reach has been just the Los Angeles County. And with Tristan and Mister, we're able to extend our reach, no pun intended, to all of California. And it's been really beautiful because even when I look through clients, it's I'm so used to working with our population here in Los Angeles from my experience. And LA is oversaturated with resources everywhere. And like San Francisco is oversaturated with resources everywhere. But then there's places that don't really have that luxury and that privilege to be in big cities where they can just, throw a pebble and you'll hit a different agency where you can go in and walk in and grab PrEP or HIV services. And so with PrEP, we're able to reach all these communities that wouldn't have ever been reached prior to this. So it's actually been a really great tool for people to gain access to PrEP that would have never had access prior or would have had difficult accessing.
well, and at the same time, like so Austin, a lot of resources, like similar, like there are a lot of places you could go, but we have people sign up for Mister in Austin, and because we end up speaking with these people, we've found individuals that are like, well, yeah, I want PrEP, but I'm not going to go to your clinic because I don't identify with your clinic. It's like, okay, but you still need PrEP. And so the resources are there. It doesn't mean someone feels comfortable accessing them. And I think that's a group of patients that we were never going to reach. It doesn't matter what we do. And I think that's been really interesting and something that I don't think we would have found before. So that's been interesting to watch. So I'm really happy that we access those folks.
Yeah, both those comments make me really happy because obviously, Mister's objective is to eliminate HIV infections. And I think it's also partnering with the community-based organizations. it's an opportunity for them to kind of expand their client base, right? Because as Reach just talked about, they have dance lessons, and Texas Health Action has clinic services. So maybe if you're offering mental health, it's a way to engage more people in your mental health program, for example.
Great. Yeah, that's really helpful. Cool. Well, I have just another question from my list as well. Can you just speak in a general term of the process of moving PrEP services to a virtual platform, and what, if you had to characterize some of like the key lessons learned or the biggest takeaways from that process, what would you describe?
Key lessons learned from.
Just beginning, kind of starting this process of moving PrEP services virtually. I know, Dan, in particular, you've worked in PrEP provision for so long, and I'm curious if you just give or anyone give a quick lesson learned about how that move has been for you all.
I think for me, it was, I had a little bit of a learning curve, even though I was so familiar with PrEP and PrEP access here in LA. Like when I got hired to do this job, I assumed I was going to be doing like PAP, patient assistance program. I assumed I was going to be doing all of the navigation. I assumed I was going to do like affidavits, and I was going to go get them all notarized, because that's what I used to do. I used to handle all of that at my old clinic. And so when I come in and I realize, oh, Mister's doing all that, I'm not doing it. It was a little bit of a breather for me. I think my biggest learning curve was actually talking to clients through like medical platforms, because up until this point I've been so used to in-person care. I've been so used to having that one-on-one with clients. And I remember when I had to like disclose my first HIV positive through like telemedicine services, that to me was a little bit interesting and not difficult, but it was just so different because it felt so impersonal, and it was such an intimate moment with a client and having to disclose that. And usually you don't want to like leave the client in this weird state where you're not sure how they're doing. And so for me, that was a big like lesson learned. But I realized that a lot of clients really didn't differ. Like a lot of them were actually very aware of what was going on in their lives. So it wasn't that difficult. A lot of them just really wanted to be linked into services and move forward. And I was glad that we were able to provide that. So like my biggest lesson learned is that I think yes, there's a lot of barriers, but I sometimes think we create those barriers as well in our heads before actually implementing them. And we realize that once the implementation process is there, it moves fairly smoothly. And that just give yourself the opportunity to grow, because there will be growing pains. Like we're still seeing those right now, which is why we're bringing in more individuals to help with this program. But for me, it's a great tool for clients. It's a great tool for my community to use. And I think that's one of the biggest things that I've taken away from it, is that at the end of the day, we're trying to provide as many services as we can that are accessible for our clients.
Yeah.
Dan, I would say that too. I think the biggest mistake we can make is not recognizing that curve is not as steep as we think it is, right? That learning curve is really big, or that those barriers are really great. Because I think that's something that, if you're providing hands-on care in a brick and mortar clinic, it's a natural resistance. You're like, but I need this, but I have these things I have to do. And I think that if your goal is reducing HIV and getting people into care and getting people on PrEP, you can't let the perfect, be the enemy of the good, right? And so I think we really have to figure out, yes, you're going to sacrifice that human touch, right? But if at the end of the day, you're getting somebody that doesn't have access to something, that access, and they're not having to drive 2 hours to get it, those barriers aren't as great as we make them. And so I think we have to kind of just reframe how we're looking at things. And I'm grateful, bizarrely, to this whole COVID pandemic for making us all do that, because I think a lot of people, patients and providers and organizations alike, have kind of realized that the barriers aren't really as great as we made them. And I think that's probably a good thing for a lot of patients. So.
Yeah, I would echo what both of them said. You know, telemedicine's been around a while, but a lot of people think, well, you know, we did a survey and everybody who comes into our clinic loves the experience, and they probably do, because you're interviewing all those people that are coming into the clinic. But what about the people that you're not reaching? And, you know, some people think telemedicine is impersonal, and other people prefer it. So, you know, if I'm going to get an HIV positive diagnosis, I would probably prefer to be at home, in the privacy of my home, than having to walk out of the, you know, the clinic through the waiting room, you know. So I think people can look at it from both sides. I think it's really important that what Megan said, it's better to have that person know and get connected to care than, you know, be out there infecting others because it's a 2-hour drive, right? And, you know, with Dan and all of our partners, it's not a cold handoff. That's really the two areas where our covered entities, our partners, become involved. So one, after they sign up, there's what we call the initial outreach call, and they're talking about the organization, answering questions about the process. And then anytime there's a positive STI result or an HIV result, it's up to the covered entity, our partner, to connect those individuals to care. And if it's HIV, then, you know, maybe it's support groups and ADAP, but it's very much a warm handoff. It's not like, here you are, you're positive, thank you, goodbye. So much better than, you know, the OraSure at CVS, right? But yeah, I can't stress enough that if you want to do something different and new, you have to take into consideration, remind yourself that it's not what you do in clinic, it's different. And that, I guess, is a shining light of COVID, is it really has shown everyone that telemedicine is viable.
Yeah, that's great. Thank you all for sharing that. So I want to turn it back over to the chat questions that we've seen come in, and my apologies if we don't get to them right now. Feel free to email us afterwards as well. I also know that it is past our time, so if anyone has to jump off, that's totally understandable. But if you would like to stay on for longer, we'd love to get a couple more questions in. And so the first one I see here is from earlier on in our conversation. Someone asked, can you work with public PrEP financial support programs like the PAPI program run by the Ohio Department of Health?
Yep, we can.
Awesome. Cool. See if we can rapid fire some of these. One person asked about access to or serving rural populations if they're lacking in access to broadband.
You know, from Mr. we have not had too many challenges with people accessing the platform. We are constantly optimizing the platform to use as little bandwidth as possible. That's one of the reasons why we shied away from, you know, developing an app, because then you need a smartphone to download it. I will say that, you know, we don't get any complaints about people complaining about access to the internet, but there might be people who have challenges and give up and don't reach out to us. So.
Well, those are probably the people that aren't seeing the ads too, right? I think that's the bigger question. And so, but we do have a couple of patients that have seen the ads because they're accessing the ads when they're out for the evening in like a downtown kind of area, and they actually drive to like a library to do their telemedicine visit, or like a grocery store parking lot, Starbucks parking lot, because that's Texas, that's rural Texas, and that works. I mean, it's not great, like we can't fix the broadband, but there are solutions, which it seems like people are accessing. I think the larger question is the people that can't access it know that it exists in the beginning, but.
Yeah, and Dan touched on this earlier. We have an organization in Alabama, and they have a computer in the clinic or in their organization office that if people don't have access to a computer or a smartphone, they can come in and register through their computer that's offered in the office.
Great. Yeah, that's helpful. Cool. So I don't want to overlook questions here. So people are also welcome to take themselves off mute and ask questions if they would like, but I can try to read some more here as well. One that we have here is, can Mister be used with a minority community-based organization that has 340B with a contract pharmacy, and they have their own HIV testing site but do not have a telemedicine doctor yet?
Yep, Dan, I would say that's exactly what Reach was a year ago.
That describes us perfectly. We don't have a provider. The providers is all done through Mr. We're a CBO. We're a community-based organization. We have 340 funding through grants. We're a storefront, so we do HIV testing here. So yeah, if that sounds like you, they can work with you. Mr.'s might be a really great option for you.
Yeah, with Mr., there's no upfront fees, there's no minimums. You know, we charge per monthly active user. So if somebody signs up in January, you know, and it drops off in March, you're only charged for the months that they're active. And we manage the provider, but the provider has an MOU with the covered entity. So it's really the covered entity's provider. But when it comes to scheduling and whatnot, that's all managed by us.
Great, great. Great. Let me see here.
Sorry, I have a quick question. You said we can unmute.
Yeah, go ahead.
This might be a little weird or silly, but so I'm a PrEP counselor. So I just tell clients that may not be insured or underinsured to just download the app and then they can go from there.
Nothing to download. It's a website. They can go to Mr.com or HeySister.com. And if they're uninsured, yes, they can sign up, but also if they have insurance. So 70% of our users do have insurance. And one of the things that we're really emphasizing is not only is Mr. a really convenient, easy to use, you know, method of getting and accessing PrEP, but you're also supporting a lot of great organizations, right? And the other efforts that they do. So, because some people do come and say, oh, I don't need that. That's a great service, but I have insurance. That's great. You know, use us. You're supporting a lot of great causes.
Yeah, and then just to touch on that as well.
Understand how that works.
There you go.
Yeah, and some people may want to keep their PrEP access separate from their primary care, so they might not want to go to their primary care for their PrEP services because they don't want to mix those. They can still keep their primary care and then use their insurance to get PrEP through Mr. if they don't want that, you know, that to be part of their primary care facility.
Okay. I have a question. Can minors use Mr.?
Right now, no, but that is something that we're working to introduce. And the reason for that is it differs by state. So we have not implemented the restrictions yet.
Okay.
I have a question.
Sorry. We have some patients who have insurance, but or young adults, but they are on parents' insurance and they do not want to use their insurance to pay for PrEP. How does that work with Mr.?
Well, we would submit them to Advancing Access, and sometimes they approve it and sometimes they don't. So, you know, I use Advancing Access as an example, but, you know, there are other patient assistance programs that we would enroll somebody in if needed.
There are actually some forms too. There's a process for someone that is under 26 for blinding their own personal health information from their parents' insurance. It's lengthy and annoying. It can be fun.
Yeah, unfortunately. Well, and sometimes it doesn't, you go through that process, or, you know, some of them you call and they say, okay, fine. And then all of a sudden their parents get
still get it. Yeah. Your mileage may vary.
Yeah. So I have a question. Did you say you had another website said HeySister.com? Is that for women?
That's for women. Yeah. But again, it's the same platform. It's just the interface is different.
Oh, okay. So this is new. This is great, because my question was I was asking to find out if women is able to download, to go online and get a request for a test for HIV.
Yep.
So they can. Perfect. All right. Thank you.
Awesome. Well, does anyone else have any last minute questions they'd like to ask our speaker? You can ask it or go ahead and drop it in the chat.
I did want to answer one question that was
Oh yeah, please.
asked in the chat, because I don't want to let it go. But somebody asked, like, what happens if somebody tests positive? Because I think that's like a real win, is that when we do identify patients that test positive, and that's a way that, because I guess what I said is, we're able to find patients all over the state, but I also said we only have clinics in San Antonio and Austin. So what happens when a patient, orders a test kit through Mr. and test positive? They, speak with our physician through Mr. and then we're actually able to refer them to an organization in their community, which then we're building a relationship with, which is great for us. And then they're getting that access in their own community. And that happens within 24 hours, which is our own sort of personal, that's what we're trying to do. And they're informed within 24 hours, which is Mr.'s policy also. So that's something that I didn't want to leave hanging, because that should not be a unanswered question. That's pretty important. So
yeah, definitely.
And with us as well, whenever we get that notification of a positive individual, it creates a process as well where we call the client. I'll usually have the conversation with him after he's talked to the provider, and we'll see if they do have insurance, and sometimes we can link them straight into their primary care and see if they offer those services. If they don't want to go through that, then I'll look for any like LGBTQ services within their facility, if that's something that they're looking for. If they don't identify as gay or bi, I look for other health facilities, and I do all that legwork for them so that they don't have to have this added stress of trying to find a provider during all of this, time of them coming to terms with their status. So I usually have a conversation with them, see where they're at, see what they're comfortable with, if transportation is an issue, and then usually we'll have another conversation once I have all of these referrals for them, and then give them some options so that they're aware of where they can go, and what their next steps are.
And that's the same thing with any positive, so we're calling them, we're referring them to whatever, whether it's a HIV positive or it's syphilis or something else, we're doing the reporting, and then we're referring them to whatever the most appropriate provider is, whether it's the county or the primary care.
Great, awesome. Well, it looked like maybe someone was, Judy, do you have a question?
Yes, my name is Judy, chronic care coordinator at Centrum in Santa Rosa. In regards to adherence for the Mr. Program or company, medical, do you mean medication adherence or adherence to their medical care?
Basically, if they're renewing and there's no interruption in service, meaning that they're doing their renewal labs and receiving their medications. So it's not necessarily pill to mouth, although we can, if an organization wanted to introduce such testing, we could see how much of do urine testing to see how much of the medication's in their system.
And have y'all heard of the Fast Track Cities campaign?
Oh yeah.
Have y'all participated in any type of facility that is also participating in that?
Yeah, we actively participated in it here in Austin, in San Antonio. Both cities are fast track cities. So 90-90-90, we're part of that. The 24-hour thing, that's 72 hours is the fast track city goal for linkage to care. So those are all, I think Mr. is a big part of identifying and linking to care. I think it's really important. So I hate to highlight, that we've identified positive patients, but I think that's really important. I think that's part of what we're doing through Mr. So.
Yeah. As soon as labs, if there's a positive STI or HIV result, our doctors are required to review lab results and respond to customer messages within 6 business hours. So
Yeah, very efficient. It's very quick. We've been really happy with that.
Thank you.
Awesome. Well, thank you all so much. I will provide my contact information here. So please feel free to reach out to me or anyone else on the Health HIV staff. I believe Tristan also shared his email earlier on. My email is eve@healthhiv.org, and Tristan's email is on the screen up here, tristan@heymister.com. Please feel free to reach out with further questions, and we will be providing these recordings and the slides via your emails after the summit once we've gotten a chance to download them and sort through them. So thank you all so much for being here today and sticking with us through the technical issues. I think this was really helpful to have this conversation and kind of do a knowledge share with you all today. So thank you all so much. You're welcome to just exit the meeting from here. There isn't anything else planned in the full room. So thank you all so much and have a great rest of your day.
Thank
all
you.
right, everyone, thank you, Eve, for organizing.
Bye.
Thank you.
Yeah, of course. Thank you.
Thank you, Eve.
Bye, everyone.
Bye, everyone.
Bye, everyone.
Bye.
Bye.
Bye, everyone. It was great. Thank you.